Okay, so start with this is blog post 3. Um, Managers use, I'm kind of going to read because there's a lot of thoughts, so here we go. Managers use a lot of skills to secure resources. The Grohar, Murray, and Langum skill, the skills that they list, I would use pretty much all of them, and I'll describe how. So I'm going to start with basically I'll use a scenario. Let's say that I need to secure more staff. So first you have to plan. This would involve creating a department budget and analyzing your current staffing situation. Their next skill that they list is organizing. To do that, I would have to examine the organization of the current staffing model. This would include vertical differentiation or the number of RNs versus CNAs versus unit coordinators. It would also include horizontal differentiation or the division of labor within the unit. All of this is part of staffing the unit, so their staffing skill is included in that. I'd also have to look at nurse-to-patient ratios and patient outcomes as they relate to our current staffing model. Let's see. Their next skill that Grohar, Murray, and Langum list is directing. There's a lot of skills listed underneath that. It could include coordinating different teams according to the needs of your unit, something like a sepsis team or a code team. It also includes supervising staff. So if we're talking about staffing levels, which is a resource we'd be securing, this would include making sure that employees are showing up to work consistently and if they're not, holding them accountable for that. This could also be an example of controlling your employees and making sure that they're fulfilling their job requirements. As a manager, I would also use my coordination skills to make sure that staffing levels were appropriately filled by nurses of varying experience levels so that new nurses had experienced nurses that they could learn and grow from. That tends to be a problem in a lot of units, especially where there's a high turnover, that you get a lot of new nurses and not a lot of experienced nurses hanging out that they can ask questions to. So on the leadership skills questionnaire that we took, I scored high in all the categories. So administrative, interpersonal, and conceptual, I scored high in all of those. So if we relate that to our scenario of getting new staff or new resources, a lot of those would probably be more conceptual or administrative skills due to planning, budgeting, and detailing the large-scale plan for the department. Some of them would be interpersonal, especially if you have to lobby for resources or go to your superiors to ask for money or that kind of thing. Still use interpersonal skills there too. To use research in presenting my plan, I would research models of nursing and staffing ratios and their effect on patient outcomes and reimbursement. It would also be important to use data from or the opinions of large nursing groups like the ANA so that have some evidence to back up the fact that maybe you need more staff. Using solid evidence would be an important tool along with my own assessments of my own unit when presenting the need for more staff or an increased budget to my superiors. I would work with different departmental groups. So you could use patient relations to examine common patient complaints, which they do in my department. It would also be a good idea to work with quality improvement or risk management and other groups that deal with nurse-sensitive outcomes. That way, we can see if there's something lacking and whether or not it relates to staffing. For instance, if lack of staffing led to an increased number of falls in my department, you could also work with the falls prevention team or the falls committee to examine root cause analysis and see why that's happening. I work at Duke. I looked at my hospital's organizational chart is more related to Big Duke than my specific hospital because they have a couple different hospitals, but their organizational charts are horizontal. So in my department, my manager has several underlings. They're clinical team leads. So the clinical team leads report to the manager, who reports to the CNO, who reports to the president of the hospital. So that's a pretty direct line of communication. If I were a next level manager, I would report probably to my nurse manager because I would be a CTL. Unless I were the manager, then I'd report to the CNO. Our model of care is total care, one nurse to a group of patients for the entire shift. So in my unit, because it's just a nurse and a tech, we also kind of do the partners in practice because the team is just me and the tech. So I am fortunate to have some really experienced techs who are also going to nursing school, and they contribute really well to our team. So the emergency room, which we are a part of, we're under their umbrella. They are going to start using a team nursing approach, which I don't know if everybody is excited about. I've done before, and it has its pros and cons. So I prefer total care. So I definitely also prefer the horizontal approach in a hospital organization. If I were a manager, I'd like to have direct access to those people that have more power than me so that I could enact more change. I'm a firm believer in low nurse to patient ratios, although I understand that they're difficult to obtain due to budget constraints. I just think that they're better anyway. I think that when asked about which model of care I prefer, the question should really be which model of care is best for both the patients and the nurses in a given situation. So this gives nurses a deeper understanding of their patients' cases, which, sorry, I skipped a part. In my opinion, that's usually total care. It's not always total care. When you have total care, nurses are able to understand their patients' cases better, and I feel like you have fewer mistakes, fewer near misses, because the nurse is responsible for the whole picture and coordinating all the different parts. So if there's a medicine that's wrong, they'll know about it. I think that it also makes the patients feel safe because they know who their nurse is, who they can ask questions to, who's going to be taking care of them for that shift. So my article that I found, I am really excited about. It is called Resistance to Change in the Nursing Profession, Creative Transdisciplinary Solutions. The author is Carrie Clark. And I actually emailed her and told her how wonderful her article was. So she says that the nursing paradigm needs a shift towards a more caring, loving, healing, and further away from task and delegation-based systems of care. So she calls this the transdisciplinary model of care for how to approach nursing. The older models of care have led to nurse burnout and resistance to change, as each generation of nursing leaves some of the problems for the next generation. She proposes that this change has to come from the inside out, and that we as nurses should stop viewing our jobs in the frame of what we know, and instead in what we do and how we connect with people. She has a website that's kind of related to, I think it stemmed off of this journal, the article that she wrote. It's called nursemanifest.com, and I looked at it. It's really awesome. In it, she says, "We do not seek to define what is radical, revolutionary, moral, or reform. We seek to call forth what is good for nurses and nursing, and what is good for the health of people worldwide. We are not questioning, challenging, or criticizing existing organizations, nor are we calling for the creation of a new organization. Rather, we are calling for nurses to join together with other nurses in whatever way they can to act consciously and with conscience. I really love this approach to nursing. It's a really good motto that nursing leaders can use to present to their staff, to shift their focus from day-to-day trivialities to the big picture of nursing. It's kind of an esoteric model of nursing, and she has more concrete examples on her website, but I think that it's a really important model of nursing. She lists many ways in which nursing care can change, such as educating for creativity instead of compliance, encouraging nurses to be deeply committed to their own healing work instead of other interests, and focusing on the human needs, experience, and quality of life instead of solely on outcomes and economics. And I think that this is such a wonderful idea that, especially as nurse leaders, you can present as a model of care. It doesn't take necessarily a shift in budget or a shift in setup or anything like that. It has more to do with motivation than anything, and helping change a nurse's perspective on how they relate to their patient or patients. So anyway, I really liked that article. I was really excited about this part of this assignment. So I will list my references, and thanks everybody.